or hypertrophic nail may cause. And then, of course, this is a similar financial burden observed in many Western cultures. Let's discuss now the pathogenesis of onychomycosis. There are many factors that can contribute to a mycotic nail, but there are several predominant components or etiologies that contribute ultimately to the emergence of this common nail disorder. Of course, it is exposure to the fungal pathogen. That this can be accomplished by simply not wearing shoes within a public bath facility, a shower, restroom, gymnasium, where a damp, moist environment persists, and that allows for the fungal pathogen to thrive and then ultimately pervade the integrity of your nail and begin to colonize within the nail plate. So exposure to the fungal pathogen, of course, in turn results in onychomycosis. However, if your body perhaps has an insufficient immune response, that could in turn allow the fungal pathogen to thrive. Additionally, if your lower extremity is suffering from some circulatory or blood flow issues, then ultimately that's going to result in a depletion of nutrient delivery, oxygen delivery, and as well as delivering immune cells to combat the onychomycosis or fungal pathogen. So we see the overall prevalence of onychomycosis increased within a population over the age of 60. Well, this is simply because they also now present with circulatory insufficiencies, nutritional deficiencies, and a compromised immune system, which fosters an environment that enable the mycotic agent or fungal pathogen to thrive. And that will, of course, result in or increase one's risk of suffering from onychomycosis. Now, the treatment of onychomycosis we see is predominantly accomplished through oral antifungal medications. Oral antifungal medications combined with nail hygiene represents truly the mainstay therapeutic approach. Now, there are various mechanisms that are utilized by oral antifungal medications. The azole family attempts to suppress the ergosterol synthesis or production, which will alter the integrity of the fungal pathogen's membranes. So there are different mechanisms or different pathways that these drugs attempt to exploit. But what we see is that across the board, the overall efficacy for these oral antifungal agents, they're not impressive. We can see some various numbers ranging from 6% nail clearance of the total population to 60%, with the best reported efficacy at 60%. Now, why is there a poor clinical success rate? Well, when we look at the slide, we see that there is only one aspect appropriately addressed with oral antifungal medications. And that, of course, is the specific antifungal outcome. Now, additionally, when we look at the delivery mechanism of a drug, it must be carried through the circulatory system. So it is reaching the infected toes through the circulatory system. And as we age, we begin to see some vascular insufficiencies, specifically within the lower extremities. This is commonly referred to as peripheral vascular disease, quite common for individuals such as type 2 diabetic patients. Now, when we have insufficient blood flow, well, then ultimately the very mechanism in which our drug can permeate the infected toes is now inhibited, or at least dampened. And therefore, we are not going to deliver an adequate supply systemically to the most distal end of the body, which is the toe. So this is an important component here because oral antifungal medications and their overall clinical utility is greatly dampened if there is some degree of deficiency in the circulatory system. Moreover, if there is a compromised immune system, then the effect of the antifungal medication, once it's out of the system, there's no natural or endogenous support mechanism in place within the immune system to keep the fungal pathogen at bay and continue to remove any remaining strains or strands of that particular fungal agent. Also, nutritional deficiency. If we have a compromised immune system, we're not delivering the correct concentration of nutrients. We're not delivering oxygen. And so we're going to have a slower rate of nail growth. And there are studies that show that nails that grow a bit slower are more likely to suffer from onychomycosis. And so these are all factors that, again, collectively contribute to onychomycosis. And these are all factors that are not being addressed by oral antifungal medications. It is very difficult to treat the distal end systemically, and it is very difficult to have a sustainable outcome when you're not addressing the other contributing factors. In addition to the limited effectiveness and high rate of recurrence, oral antifungal medications have also been associated with some benign adverse events as well as some very severe adverse events. Oral antifungal medications have been associated with hepatotoxicity. This has actually resulted in several liver failures. Now, although extremely rare, this highlights the risk of this particular medication. It also highlights the idea that with only the best medication showing a 60% clearance, is it worth the risk with such a low clearance rate? Is it worth the risk of consuming this medication knowing that you may suffer from some degree of hepatotoxicity? And so these are the questions that ultimately patients must be able to answer and truly appreciate when there are viable alternatives emerging. Additionally, at least in the United States, all patients must undergo liver function tests at baseline in weeks 4 to 6 to ensure that, yes, the liver is actually handling the oral antifungal medication and there is no toxic effects. This also is going to result in the idea that not all patients can actually qualify to consume oral antifungal medications due to pre-existing health conditions. Perhaps they're taking a medication that is metabolized in the liver, and ultimately this oral antifungal medication could affect the overall metabolism, and so we can see adverse events that have been reported. So there are many patients that cannot consume these medications, and there are many patients that should not be consuming these medications. So it's really now looking for that alternative therapeutic strategy. The overall limitations of oral antifungal medications demands that alternative effective solutions ultimately emerge. And that's where Lunula comes in. Lunula is the first multifaceted treatment of onychomycosis. It utilizes laser energy, delivering 635 and 405 nanometers. So what does that mean? Well, 635 nanometers means red light or red laser, and 405 nanometer delivers violet laser. When delivered concurrently, as depicted here in the image to the right, when delivered concurrently, we are addressing the numerous etiologies or factors that contribute to onychomycosis. It is that concurrent treatment of those two different wavelengths that allow for this treatment to be multifaceted. Now, simply a patient places their foot into the Lunula apparatus and receives 4 12-minute treatments separated by a week. So they come in on Monday 1 week for a 12-minute treatment of their diseased extremity, come in a week later for another 12-minute treatment, so on and so forth. This is a technician-independent application. Once the patient places their foot into the Lunulate technology, the technician activates the device. He or she can now exit the treatment room so that the patient receives a private, comfortable treatment during the total of 12 minutes. Now, when we look at the overall science of Lunula, it adheres to the principles of photochemistry. And what does that mean? Well, that simply means that there must be a molecule capable of absorbing the specific colors of light, or wavelengths as they're referred to, being emitted by Lunula. Now, upon activation of these photoreceptors, ultimately what happens is that its functionality or physiology is changed. That then affects biochemical reactions within the cell. So you see in the image on the left here, we can see that stimulation of this receptor activates what are known as intracellular signaling enzymes or proteins, which then in turn activate effector proteins. So this is known as a secondary cascade or secondary messenger system. One item's activated, which then activates another one, perhaps two other components. Those two activate two more, so on and so forth, until this transitions, or this signal is transmitted throughout the entire cell, and that's what's going to change the cell's physiology. So photochemistry is the stimulation of a receptor, which then affects these intracellular signaling molecules, which then affect ultimately effector proteins. That overall changes the functionality of the treatment cells. This is very similar to the mechanism of a drug known as an agonist drug. Basically, we have a nice depiction here on the left of an agonist mechanism. We have this extracellular signal that binds to the receptor. Upon binding to that receptor, the receptor's functionality changes. That then alters specific proteins here, highlighted by this pink pathway, or it could alter other proteins highlighted by this green pathway. Overall, however, the cell's behavior is altered, and all of that transpires by stimulating just one receptor with one molecule. And ultimately, that's how photochemistry works. We stimulate one receptor capable of absorbing light. That then in turn will activate these alter these protein functions, which will alter the cell's behavior. When we refer to the lunula now on how it's changing the overall cells in the treatment area to effectively target and remove onychomycosis, we have to break it down per wavelength. We have two different wavelengths that are delivered by Lunula. We have a 635 nanometer wavelength, which is a red laser, and we have a 405 nanometer wavelength, which is a blue laser. The red laser activates a pathway known as nitric oxide synthase. And nitric oxide synthase is a mechanism that's responsible for producing nitric oxide. So when we introduce the 635 nanometer wavelength with Lunula, that activates the nitric oxide synthase pathway, which produces NO, and then NO can result in smooth muscle relaxation. That increases blood flow. So 635 nanometers has an extensive background on improving blood flow. In turn, as we look at 405 nanometers now, that activates what is known as NADPH oxidase. That is simply an enzyme that's responsible for producing reactive oxygen species. And we know that reactive oxygen species is necessary for killing foreign invaders, such as a fungal pathogen. When we combine the two, when we produce 635 nanometers, and when we stimulate with 635 nanometers and produce nitric oxide, and we introduce 405 nanometers to produce reactive oxygen species. What we see here is depicted eNOS, that's just nitric oxide synthase, producing NO. And here we have NADPH oxidase producing a free radical. They combine to produce something known as peroxynitrite or acidified nitrite. And this is a cytotoxic substance that has been proven in several studies, and there's a citation down here, I apologize if you can't see it, that shows that acidified nitrate is a potent antifungal molecule, successfully eradicating dermatophytic fungi. And so by combining 635 nanometers with 405 nanometers concurrently in Lunula, we believe or have postulated that we're able to produce this acidic or acidified nitrate, which is a very potent and powerful antifungal agent. By simultaneously delivering 635 nanometers and 405 nanometers, Lunula is the first multifaceted treatment of onychomycosis. We see in this particular slide that Lunula is able to successfully address the four major contributing factors of onychomycosis. By delivering the 635 nanometer wavelength, we are able to increase the production of nitric oxide, which results in vasodilation, increasing circulation to the lower extremity, as well as some studies have shown that 635 nanometers promotes angiogenesis, which is the formation of new blood vessels. At the same time, we're delivering 405 nanometers, which is violet or near UV. 405 nanometers has been shown to be one of the best producers of reactive oxygen species. By producing reactive oxygen species that can react or combine with nitric oxide to produce peroxynitrite or acidified nitrite, which has been shown in clinical literature to be a very potent antifungal molecule. So by introducing 635, we're able to increase blood flow, increase immune cell concentration by doing that, while weakening the fungal pathogen, if not eradicating it, by producing peroxynitrites, as it's been proposed, by producing reactive oxygen species along with nitric oxide, which the two then combined. So you can see here once again, improved blood flow, it delivers more immune cells, compromised immune system treated. Circulatory insufficiency, obviously increasing the blood flow addresses that, and then nutritional deficiencies, knowing that increased blood flow has occurred, that means more nutrients and oxygen is going to be delivered to the tissue. All of these components collectively allow for Lunula to successfully address the colonization of the fungal pathogen. Now, understanding these basic principles and postulating or predicting the overall mechanism of action, what we had to do, of course, was to exhaustively analyze the clinical utility of this nice combination of 405 nanometers and 635 nanometers. So in November of 2009, the first clinical study was organized. This was a 168-toe study evaluated across 3 U.S. Clinical sites. The protocol included a single 12-minute treatment. There was no nail debridement. An antifungal spray was used, but this was simply applied to socks, shoes, and other selected surfaces at home. No other adjunctive modalities were permitted. This included topical antifungal applied directly to the toe, oral antifungal. There was a washout period. No adjunctive components were used. Follow-up period was a bit sporadic, ranged between 9 and 72 weeks, but this was considered a pilot investigation. Now, the overall nail clearance at month 2, the nail was clear by 1.9 millimeters. By month 4, the nail was clear by 4.06 millimeters. By month 6, the nail was clear by 4.92 millimeters. And by month 12, the nail was clear by 6.29 millimeters. So this shows an effective clearance of the nail following a single treatment with the Lunula technology, and these were statistically significant changes. This was published in 2012 in Lasers in Surgery and Medicine as an abstract. Now we see some before and after images, the change, starting out here with the date 4511 and ending at 10/18/2011, so 26 weeks. We can see that the disease state begins here, a good percentage of the toe, and then we have a nice overall, a smaller percentage of the toes consumed by the mycotic agent, and a little bit of discoloration remains. Here we see a toenail with its discoloration, this distal lateral type approach or progression. We can see some altered patterns here in the consistency of the keratin layers. And then 8 weeks later, we see a beautiful and consistent clearance of the nail that extends out to 27 weeks. Here we see a diseased nail. We can see the discoloration over time. The new nail is beginning to grow in 14 weeks after the single treatment of Lunula. And 27 weeks, we have a beautiful growth of a nice, healthy, clear nail. Moving into patient D, we see discoloration. Evidence here of the mycotic entity. We see a nice progression here. Some discoloration remains, and then we see the nail ultimately. The discoloration has been ultimately resolved with a little bit of the pattern up here that still remains, but that eventually will grow out as long as that nail is growing in relatively clear. So we have a good line of demarcation here. Here's that line there. Nice clearance coming in, and now here's that line right there. So we can see where that discoloration remains, and eventually it'll grow out completely. Here we have a nail treatments for 1111 to 10/24/2011, 27 weeks. Here we can see the discoloration extending across, and then of course we have just a mild remaining of discoloration. Eventually that will grow out as well as we continue to progress, and this is following one Lunula treatment. This is patient F. This is a rather dystrophic nail, discoloration in the pre-procedure. Watching its progression, we can see that the new nail is growing in quite nicely. Over time, we extend into 27 weeks. We have a beautiful growth, still some remaining, but eventually that will grow out. So highlighting here the timeliness in the response and just the overall clinical utility, absent or devoid of any side effects whatsoever. Now, that previous study was a good baseline. It established some clinical utility of Lunula, but it was necessary to perform a better controlled study with specific terms of follow-up. So this was an FDA clinical study. It enrolled 75 toes. That was 105 subjects, 75 toes, across 3 clinical sites in the United States. Instead of one treatment, 2 treatments were applied, 2 12-minute treatments. Again, no debridement of the nail was performed. An antifungal spray was used to spray shoes and socks and selected surfaces at home. And just more importantly, no adjunctive modalities were utilized in this clinical investigation. Assessment, we had 4 evaluation periods, baseline and months 3, 6, and 9. So well-defined post-procedure evaluation. When we look at the objective data, the nail clearance at month 0, so baseline, roughly across the entire population, the average of nail clearance at baseline was 4.6 millimeters, meaning that 4.6 millimeters of the nail was already clear. This equates to roughly 43.4% of the nail. By month 2, 7.62 millimeters of the nail was now clear. That's 62.9% of the nail. By month 3, 9.59 millimeters of the nail was now clear. That's roughly 73.8% of the nail now clear. And by month 6, 10.76 millimeters of the nail was now clear. That's roughly 79.8% of the nail. So we saw an improvement in overall nail clarity of 6.15 millimeters as we take the difference between the 6-month evaluation and the baseline evaluation. So that's showing a statistically significant change in overall nail clearance. Here we have some great before and after images. We can see here that the overall monitoring system was more extensive. So here we see the discoloration nicely demarcated here by this measuring scale system. We move about a month out to 9/12, monitoring the overall progression, and then 12/18 we see a beautiful clearance of that nail with just a little bit left to grow out. But of course we are understanding that the rate of nail growth can be hampered when onychomycosis is present, and so we're looking roughly perhaps 1.8 millimeters per month of nail growth when a nail is diseased. Here we see baseline discoloration, having this distal lateral growth pattern. Moving out a month, we can see some improvement, and then ultimately by 12/18/12, we're having a beautiful clearance here with some discoloration remaining, but eventually that will grow out as we are dependent upon nail rate of regrowth. Patient C, we can see here, caliper was used to highlight the, and that was ultimately how it was measured. A caliper was used, but this allows us to go to the proximal area, the proximal region here, and moving towards the distal area, and we can see the distance here that was measured, moving across baseline into 1 month, and then by 1/14 we can see some changes as it traverses the midline or middle portion of the nail. Some remains here, but we're seeing some clearance. So ultimately this is a subject that has shown some improvement but still continue treatment. Here we see ultimately the measurement. Patient D, we can monitor their progress and seeing the general overall clearance. We see a beautiful clearance here as it progresses upwards. Out, still a little bit of discoloration that's slowly growing out on the lateral aspect here, but just showing the nice bulk clearance here. We can see the dramatic difference as the discoloration extends here, consuming a majority of this right lateral portion, and we can see now here on this far right image, it just encompasses this small area here. So good growth, still a little bit here, just waiting for that to particularly grow out. Moving on to patient E, we see again in the baseline at 9/4/12 where the clear nail ultimately begins. We monitor that into 9/25/12, and then roughly 4 months later we see a beautiful clearance of this particular nail, which allows us to see dramatic changes and improvement following that single Lunula treatment. Patient F, looking at the overall clearance, we can see here on the left foot, there is a nice demarcation here, a nice line that segments the cleared and diseased portion. We can see that line moving upwards, showing that there's a bit of clearance coming in. And now when we look at the discoloration and compare it to the final, we can track that line, which is now up towards the distal end of the toe or the nail plate, and we can see a beautiful colored nail with a consistent color has emerged. So this is a fantastic result on this patient's left foot. Patient G, we can see that there's discoloration along this upper distal region of the nail, tracking in a few about 21 days later, and then ultimately 4 months later, we can see that it's beginning to grow out nicely from this particular subject. It's just taking time for that to grow out, and that's simply dependent on the rate of regrowth. Patient H, we can see the discoloration here, extending down laterally in a distal manner. we see ultimately are moving distal to proximal. We see a bit of clearance, and then ultimately moving into that 4-month zone. We see a nice clearance here with just a few on the outer edges. Eventually that will grow out as well. A nice close-up of the discoloration, disfigurement of the nail. We can easily see a nice clear defined line that segments the clear nail with the diseased nail, and a few months later we see ultimately a beautiful clearance of this particular nail that highlights the overall clinical utility. Patient K, not a substantial infection, but ultimately we can see the discoloration where it exists and a beautiful clearance just following several months later, so after the 2 treatments with the Lunulate technology. So hopefully we were able to articulate the basic science of Lunula. These webinars or conversations, it is important to understand that they are discussed from a cursory perspective, meaning not elaborating in too great of detail with the photochemistry and biochemistry that follows. Ultimately, however, this is not a way to circumvent these important questions. We would be more than happy to address any and all questions regarding the Lunula technology and the clinical data that has been obtained to support its overall efficacy. So with that being said, I would just like to thank you for attending. I hope this was informative. I hope that I did my best to educate you on the overall clinical efficacy and safety profile of the Lunula technology. Thank you very much.